Moving on towards our next keynote presentation, which I'm sure many of our participants are waiting for, is by Mr. Tiago Vacas Felgueira, Product and Innovation Head, AdvanceCare, who is our gold sponsor. And Tiago will be speaking on telemedicine evolution in health ecosystem. Welcome to you, Tiago, and the stage is all yours.
Thank you. Hello, everyone. I'm starting to present. Give me. I think everyone I see the presentation, right?
Yes, we can see it. If you could please click on presentation mode.
Yes. No, it's okay.
Perfect.
Right? Okay, I'm start to present AdvanceCare. AdvanceCare is a company founded in 1998 with a joint venture with local insurance and international insurance like Munich Re and United Healthcare. And it was a joint venture for managed insurance health claims. Today, we are a part of Generali Group and Europa Assistance. And we have in our value proposition, we have around 1.3 million final customers, 14 institutional clients. We pay around, we process around 315 million of claims per year. And we have around 50,000 providers in our network. We are a Portuguese company, and we work with local partners and also with another countries like Angola, Mozambique, Italy, etc. So our main assets, our brand. We have 20 years of experience in Portugal, so we are known in Portugal with a health brands. Clinical expertise, so we have around 14 doctors working with us, plus nurses. Our provider network with negotiation of the providers. Operational effectiveness. We aggregate and purchase and have more efficient and peak management. Our technological infrastructure, and today it's very important. We have 98% of our electronic invoicing used by interfaces. And in the same number for reimbursements, we have online reimbursement launch in 2017, and today we have almost 100% of the claims without paper and data. We have in 20 years a lot of data indicators we collect for a lot of sources, and we can have make a benchmark in Portugal, health frequency and cost trends for help our customers to take the better decisions. So after this small introduction about who is AdvanceCare, let me talk about telemedicine. So what was the evolution of telemedicine in Portugal, and what I'm listening for the other panelists, it's almost the same for every part of the world. So we start with teleconsultation in 2017. However, we don't see a lot of utilization by our clients. We don't really understand why, because the teleconsultation, when we launch, was for free. You don't have any copayment. It's more easy to do for the clients because you don't need to pick a car and go to urgent care or physical care, wait 2 hours for the doctor. However, the customers don't use. What we saw after the start of the pandemic in 2020, a lot of barriers are loosed with the teleconsultations. And today, if you see on the graph, we start in January 2020. It's the index 100. And today we have 65 times more teleconsultations than we have on the beginning. So why that change? Why? Because after the beginning of the pandemic, the clients are afraid to go to a physical consultation because they are afraid to being infected. Sometimes the hospitals are closed in the beginning of the pandemic, and the users start to use. And when they start to use, and if we see the NPS, it's very high, they understand it's better for what they have to start to use the teleconsultation. It's important to understand, I don't really know, I believe in the rest of the world is the same. In Portugal, if you have a flu or a cold, if you have fever, you run to the emergency care. And in reality, it's not emergency care. We know 75% of the utilization of emergency care in Portugal is not for emergency needs. So when the clients start to use the teleconsultation, they like it, they understand it's better, it's more easy to use and starting to use. In this chart, if you see if you see a frequency in outpatients, we have a very high decrease in March, April, and May. It was the first wave of COVID-19. And it's when start to use a teleconsultation. However, today we have the same frequency. It's normal for the pre-pandemic numbers, and the adoption of teleconsultation still to increase, because the clients and the patients start to use, they understand the value of teleconsultation, understand they can get the answers for their needs, and they like it. And it's only needs to make a call or online booking and use and talk with the doctor. So what we start to make to improvements, because when we start in 2017, the teleconsultation, the value of teleconsultation, it was a phone number only for the clients start to use. We don't have a lot of usage in the pre-COVID. However, when we start to get more users in utilization, we start to improve our user experience. And what we create, integrate several digital services. The first one is an online triage with a symptom checker. We make the patient eligibility because some type of clients have access and another ones cannot have access. Some clients need to pay co-payment, and other ones don't have to pay nothing, it's for free. We have also electronic prescription for prescription exams or drugs, a digital referral, because according to your symptoms, we can refer the client for emergency care, for booking physical consultation, or booking for exams. It's an online gatekeeping. Also, we have also online gatekeeping. Improve the UX and UI of the teleconsultation is RGPD compliance, and we are increasing offer demands for medical specialties. Because in the beginning, when we start, we have a general clinic. Today, we have pediatrics, we have psychologists, we have psychiatry, dermatology, gynecologists. It's we are increasing new specialties, because in the beginning it was only for urgent care or acute care, and today it's not only for acute care. So what is our full telemedicine digital integration? So the customer journey starts with the symptom checker, and the symptom checker it's important to get the referral, the client, for the correct type of consultations. and collect a lot of data about the clients and trends. It's important. It's a way we have to understand what the clients will need in the future for specialties, update the patient records, and engage the user and give to the doctor prior information about the patient. The onboarding, it's important because the clients, something, if you see on acute care and if you go to a physical room, you cannot choose the doctor. It's the first doctor you get, it's the first doctor you have. In online, you can have two types of ways. One is exactly the same. Another one, you can check the doctors and a small bio and choose what is better for you. You have the schedule and the payment. It's a booking, and you can make an online payment if you have co-payments or not. And in co-payments, we have three ways to make the payment. In Portugal, we have a way to use a phone number to make the co-payment. It's one. Another one is a credit card or a bank reference. You can use it also. You have the teleconsultation, and in the end of the teleconsultation, the doctor, and it's important, during the teleconsultation, the doctor can ask to another doctor of another specialty to enter on the call and helping to better diagnosis of the clients. The doctor can and the client can share documentation to the doctor. Doctor in the end prescribe the drugs or exams, and you receive an SMS or email with a prescription. You can ordering home delivered drugs also, and after that you have the follow-up. It's the follow-up. Give the clients two things. One is the feeling satisfaction questionnaire, for we understand where we can improve. It's important for us. The second one is to check the health status of the clients. If you go to urgent care in a hospital for acute disease, no one, at least in Portugal, no one send you an email or SMS asking if you are better or not. And with teleconsultation, we can do it. And one day later, we can ask the client, you are better? If you want, you can have another teleconsultation. It's important to involve the client on the flow. So what we have in evidence, the evolution of the Symptom Checker, and the first one is we start in 2020 with the Symptom Checker. Symptom Checker is a way for the clients feel their make assessments of their symptoms and get a diagnosis. We retrieve three diagnoses to the client. One is the most probably what they have, and the last two ones it's the less probable of they have. So this type of symptom checkers is based on artificial intelligence, and they are clinical validated. They cross a lot of information about the client and the answers of the clients give. If you are in Qatar, they have type of disease we don't have on Portugal, and we cross the localization and get a better diagnosis of the client. So what we saw in the frequency are still increasing 2024, 2021. We have a fast adoption of this type of solution. And what we see of the urgency level of the assessments in 2021, it's what we know about acute care. Is around roughly 75% of the users who start to use the symptom checker, they are eligibility for make teleconsultation or self-care. we cross this information for check what the client does after using Symptom Checker. And what we saw is 79% of the clients don't have any visits, and 21% go to a visit in the next 7 days. And 2% make PCR for check COVID-19. It's normal because we are in the end of pandemic. So in the teleconsultation, what we see? We start a very, very, very low frequency in 2019. It's almost around 0%. In 2020, it's increased for 1,000%, and we double in 2021. So the COVID-19 is the adoption acceleration of the uses of telemedicine, and still increasing. We have the numbers of 2022 and still increasing. We have more usage in 2022 when, if we can compare with the same months in 2021. So if we cross the same information with the Symptom Checker, the first call resolutions for acute care, what we see is 96% of the clients use teleconsultation don't require additional doctor in the 7 days using the teleconsultation, only 4%. It's normal because if we go to a physical consultation, is exactly the same. Almost the people don't require any other consultation. A few will require something else. If we look to the prescription, we have because something was one our doubts is the teleconsultation will increase the prescription if we compare with the physical consultation. No, it's not true. The behavior is very similar. 6% are drugs prescribed by the teleconsultation. 40% are exams, and in these exams, 23% is PCR. It's normal because we have roughly 15% of the users who call to teleconsultation required is related with the COVID-19, and the 17% is for another type of exam. So the consumption is exactly the same or a little bit less than a physical consultation. So it's what I have to show you, and thank you. If you have questions, just send in a chat.
Thank you, Tiago. I don't think we have any questions coming in at the moment. If there are any questions, we will definitely get back to you on that, and we'll send them to you so that you could address them, right? So thank you, Tiago, for your insights and presentation. Was very, very informative. I'm positive our participants definitely got lots of information from your keynote. And I'd like to, remind all the participants to visit the AdvanceCare booth and see what they have to offer all of you. Thank you once again, Tiago, for joining us. Have a great rest of the day.
Thank you, Roger.
My pleasure.